The objective of this study was to summarize the efficacy of shared decision-making interventions on patient-centered outcomes. Methods include searching multiple databases and performing an environmental scan to identify non-published research results through expert consultation. Multiple data extractors were also used to independently pull data out of the studies. Risk of bias assessments were performed independently in duplicate, and statistical analysis on the patient-centered outcomes that were measurable was done to calculate standardized mean difference. Inclusion criteria were fairly broad, including the definition of shared decision-making used by the researchers, which was anything that involved patients or their caregivers in a medical decision-making process with clinicians. The studies that were included were not limited by study design, and the target audience for the intervention could be either children, parents, or a combination of the two. The only real exclusion criteria was that studies that were designed to aid decision for research participation were excluded, as well as antenatal and perinatal care. There were initially about 1,700 studies identified, but 61 were included. And of those 61 studies, they described 54 unique interventions, and 15 of those gave enough data and were quantifiable that could be included in the meta-analysis.